My father was almost 71 years old and he had a knee injury almost 3 to 4 years back. Both the legs, knee has got tempered, and because of that his daily habits are got uh, restricted. Even he is not able to sit on the ground or not able to walk or stand for continuous more than half an hour.
ಭಾಳ ಅನ್ನಿಸ್ತಿದೆ, ನಡೆಯಕ್ಕೆ ಬರಾಕತ್ತಿದ್ದು, ಎಲ್ಲ ಆ್ಯಕ್ಟಿವಿಟೀಸ್ ಎಲ್ಲ ಬಂದಾಗಿದ್ದು.
He consulted a couple of doctors and they told the knee replacement is the final solution. So post that we decided to bring him back to the Bengaluru and get it knee replacements. When he has consulted Dr. Avinash, so he told we will operate on both the legs. Even on the operation day, it almost took almost 2 to 3 hours. He got the knee replaced. On the same day, he used to walk with the help of physiotherapist. 3 to 4 days gap, his other knee got replaced, and within 2 days he got discharged from the hospital. And with the help of physiotherapy, and initially he used to use the walkers, and I think in 2 weeks he stopped using the walker, and with the help of stick he used to walk around inside the house.
Mr. Arun was brought to us by his son Akshay. He was having problems with both knees for about 5 years. They came with a specific request for knee replacements on both knees. We analyzed his situation, and he was relatively fit, which is when we decided to give him a go ahead for both knee replacements in a single admission. He was well motivated and he recovered well. He underwent physiotherapy sessions, and overall his recovery has been smooth, and over the next few weeks I expect him to be increasingly active, and hopefully that will restore his normal lifestyle, and he'll be able to enjoy a better social life too.
ಸೇಫ್ ಸರ್ಜರಿ ಕೆಂಗೇರಿ ಹಾಸ್ಪಿಟಲ್ಗೆ ಆಯ್ತದ, ಸರ್ಜರಿ ಆಗಿದೆ, ಫಸ್ಟ್ ಕ್ಲಾಸ್ ಆಯ್ತು. ಎರಡು ಕಾಲ ನಮಗೇನು ತೊಂದರೆ ಆಗಿಲ್ಲ. ಒಂದು ಹೋಪ್ಸ್ ಇತ್ತು, ಬಾಕಿ ಹಾಸ್ಪಿಟಲ್ ಇದ್ದ ಗುಡ್.
So the overall experience is very smooth, and even I could suggest who is having knee pains, they should not worry about getting about false narrative from the others. They should consult the doctor and get all their doubts clarified, and they should go ahead with the knee replacement surgery.
30 days ಆಪರೇಷನ್ ಆಗಿತ್ತು. ಈಗ ಐ ವಾಕ್ ವಿದೌಟ್ ಸ್ಟಿಕ್.
So on the occasion of World Arthritis Day, let's go through the top 5 questions that most patients have regarding total knee replacements. So the right time to have a knee replacement would be when the patient is suffering from knee joint pain and it is beginning to affect their activities, be it walking or getting into a car, sitting on a stool. Patients begin to start avoiding social activities, and also they would have failed non-operative methods of treatment. That would be the right time to think about a knee replacement. In the early stages of the disease, it's quite important to stay active. Consider non-operative treatment measures like a brace, involve in low impact activities like swimming and cycling, walking. These to some extent can delay the requirement for a total knee replacement. Knee replacements can last a long time. Generally, the way we plan it, it is designed and performed in such a way that they outlast the patient. The knee joint implant has metal component and a plastic component. The metal components generally outlive the patient. The plastic component can wear out over time. However, about 90% of patients can expect their knee to last at least 15 to 20 years. So the knee replacement surgery that we perform here, we utilize minimally invasive techniques and multimodal pain control techniques. This allows the patient to walk within a few hours of the surgery. Over the next 4 to 6 weeks, we recommend that the patients have physiotherapy. Patients generally use a walker or crutches for the first few days or weeks, depending on their general condition, and once they are more confident, they are able to walk without any support. The wound of the knee replacement heals within 10 to 12 days, and in about 3 months we expect the patient to be more active and enjoy a more active lifestyle. Generally, it is accepted that unilateral knee replacements are the safest option. In some patients who are free from other diseases affecting the heart, lungs, or have not had strokes or blood clots, it may be safe to consider bilateral knee replacements. Bilateral knee replacements may either be performed simultaneously, which is under the same anesthetic, or performed in a staggered manner, where the 2 knee replacements are performed with a gap of about 3 to 4 days, or they may be staged, wherein the knee replacements are performed with a gap of 3 months or more. They can be safely executed. However, patients who have multiple comorbidities or diseases like heart issues or lung issues, they need to be counseled regarding the slightly increased risk of complications if it is performed simultaneously.